Yeah, welcome everybody to my presentation for the summer webinar, and thanks for inviting me today. I will talk about the importance of a user-centered approach when designing an exoskeleton today, and also the challenge when implementing an exoskeleton in the work field. As a short introduction, for people who don't know me or my name, I'm Saskia Baltrusch, and I did my bachelor's in Germany in sports sciences, and then decided to go abroad and did 1 year master in human movement sciences in Amsterdam. And after that, I decided to stay in Amsterdam and wanted to get more knowledge in human movement sciences and also more experience in research, and started my PhD in human movement sciences. And during my PhD, I was part in the SPEXA project, which was a project that had the aim to develop and evaluate a back exoskeleton for low back pain prevention and vocational reintegration. So I will talk a lot about that research that I've done in these 4 years today, but I will also talk about some work experience I've collected in the last year, because now I'm a researcher and scientist innovator at TNO. That's a Center for Applied Research. So we're closer to the field now, and we're still doing a lot of projects on exoskeleton implementation as well. This is my thesis that I wrote within the SPEXA project, Lifting Success of Trunk Exoskeletons. And I wanted to show how we can bridge a gap between biomechanical solutions, so in this case in exoskeletons, and end users' perceptions. So how can an user-centered approach support us in designing an optimal exoskeleton for the end user? I would like to start with a use case here, which is a luggage handler at an airline company. What they basically have to do is load these suitcases from the belt onto the carts or the other way around, and that for 8 hours a day. So a lot of people within this company developed low back pain in the last couple of years. And the company is aware of that, and that's why they already implemented automated processes, but also a couple of lifting devices. This is one example. This is a robot. I think they have like 3 standing in their working environment there. And what it does, it basically scans the dimension of the suitcases. It has like cameras on this metal plate. Then it picks up the suitcase, and it scans the container, looks where there's space, and then it puts the suitcase wherever there's space in this container. One problem about this, as you can maybe already see, is that it's super slow, so it's not really effective. Manual work could actually be faster, but they can't increase the speed because then apparently there are a lot of problems coming up. And because also the robot makes mistakes, sometimes a person still has to manually correct that. So it's not really efficient. Then they have 2 other lifting devices hanging everywhere in the holes. On the left side, you see one that works with air pressure, so you suck up the suitcase and then you release it again. Or a lifting table. You can adjust that in height, and then you just pull the suitcase on it, and then you pull it off again. The problem about these ones is that they hang everywhere in the halls and they're available for everyone, but nobody really uses them. And when you ask the employees, they say the lifting device is good, but it's slow. Manual work is faster and is hindering more than it is helping. Well, and this is a perfect use case to basically show that not the first step that you should normally do, adapting the working environment, and look how you can help people by adapting the working environment to unload their back, is not always the best solution, as it might not be efficient or people might not use the implemented devices. And in that case, you can use an exoskeleton. The question now is, how can we design an exoskeleton that is good for this use case? In the SPEXA project, we took a user-centered approach, and I would like to show you why this is really important to do that. We started with benchmarking, so testing exoskeletons that were already on the market, and we started with discussion rounds, focus groups with potential end users, so not only luggage handlers, but also low back pain patients and healthcare professionals. And we asked them about their view, what kind of worries do you have about using exoskeletons, or where do you have wishes for the design of the exoskeleton, things like that. Then we developed the exoskeleton. Then we did an iterative testing with the people from the airline company. And after that, we had again discussion rounds with the same people and their managers. And I'm just going to go through some examples how the input from the end users helped us in designing the exoskeleton, but also in how we studied the exoskeleton. The first example is that one of the people in the discussion said, I would like to have like a button on the exoskeletons that you can switch between on and off, so that you can basically switch on and off the support. Because in certain movements I might not want to have the support, and in other movements I do want to have it. And that was interesting because when we did the benchmark tests, we had similar results. In the benchmarking, we tested a Levo device, and we basically asked the participants to perform a set of working tasks, so tasks that you can think of in a daily working environment. And they had to do that once with and once without the exoskeleton, and then we asked them to state whether they felt supported or hindered by the exoskeleton. And the green boxes show in which they felt supported, which was only one task, static forward bending, and the red boxes stand for the tasks in which they felt hindered. So they felt hindered in a lot of tasks, and that was mainly because they were working against the support of the exoskeleton. So that basically also gave us the result of, okay, if we design our own exoskeleton, we need the possibility to disengage the device, which was in line with what the end users said, potential end users. So we did that. This was the exoskeleton design. We had two components, the carbon beams on the back and the springs on the side on the thighs. The carbon beams were for supporting the trunk flexion, and the springs on the side of the thighs for supporting the hip flexion. And they both release energy if you go down, and save energy when you go down, and release that energy when you come up again. And then we implemented a clutch system, which has a little lever arm that you can pull up and down, and by that disengaging the springs on the thighs. So you basically disengage the support for the hip flexion, which makes people be able to just walk around without constantly working against the support of the device or the resistance of the device. So we did then the same test again, as we wanted to know, well, did they change anything? And the first thing you see is, so here in the bottom you see the new results. There's a clutch system. There are no red boxes anymore, so people did not feel hindered anymore in any of these tasks. So the clutch system actually worked, which shows the importance of having a switch on-off button basically for an exoskeleton. Another example was that a lot of people, whether it were back pain patients, healthcare professionals, or also the employees, they always said, if you don't use your back muscles the whole day because you're wearing the exoskeleton, then the muscles get weak, right? And that's a big concern from potential end users. And so we decided to measure the effect on muscle activity when wearing an exoskeleton. And we also measured the effect on metabolic health, so oxygen consumption, to show an additional parameter that can show whether you get support by the exoskeleton or not. So we invited people to the lab from the luggage handlers, and they had to do a lifting task for 5 minutes with and without the exoskeleton, and we saw that when they were wearing the exoskeleton, the oxygen consumption decreased by 18%, and that already showed that there is a support by the exoskeleton. The muscle activity also decreased by 10 to 16% when wearing the exoskeleton. And as you can see, it's 10 to 16%, so it means your muscles still do quite an amount of work. So over a longer period of time, you don't expect the muscles to get weak. To really know that, of course, you have to do a longer study. But what we learned from that is that you should always use an exoskeleton temporarily, and you should have an adjustable support. So people can decide whether they want to have 20% support, whether they want to have the full support, or maybe only 50% support based on the task they want to be supported. Two other statements that I put on one slide here is, one came from the healthcare professionals, that they were afraid that people might get dependent on the exoskeleton and lose their confidence in their own body. and the managers were talking about implementation strategies and whether an exoskeleton should be obligated to protect people against themselves. Why I put them here on the same slide is that I think both of these statements basically show that when implementing an exoskeleton, what really matters is communication. How do you communicate the implementation of an exoskeleton can really influence the acceptance of the exoskeleton. So lessons learned from this research are an exoskeleton can potentially prevent from low back pain. The optimal design of an exoskeleton is context dependent. So if you measure it in one context, doesn't mean that it's going to be the same effect in another context. And user-centered approach is important to aim for optimal exoskeleton design that really is for the specific needs of the user. And it is important to have an adequate implementation strategy. Well, and the last point basically brings me to the work that I'm doing now at TNO, because there we're closer to the field, and we're also doing field testing as exoskeletons towards do companies really want to implement exoskeletons? And there are quite a lot of challenges. One main challenge is that a lot of companies, for example, are not even aware of exoskeletons, especially the small companies. They don't even know that exoskeletons exist, let's say, or that there are a potential solution. Yeah, and that brings me to a project that we're doing currently at TNO. It's a big European research project in the North Sea region with a lot of international partners. It's called Accelerate, and the objective of that project is to accelerate the adoption of exoskeletons into construction and industrial manufacturing. And the methods we're using is that basically every partner in their region comes up with ideas for workshops to reach that goal. And we had a big workshop last month actually called Exhibition and Talk. And the goals of this specific workshop was to connect exoskeleton developers with companies interested in exoskeletons. So we invited about 15 companies that were interested in exoskeletons or also had some experience with it already. And we also invited a wide range of exoskeleton developers. And we wanted to identify challenges and barriers for implementation of exoskeletons from the company's perspective. And we also wanted to share our knowledge on potential benefits of exoskeletons in industry. These were the exoskeleton developers that we invited. So we had shoulder exoskeletons, we had back exoskeletons, rigid back exoskeleton, and also soft back exoskeletons. They were all passive, but we also had one active back exoskeleton, the Cray X from German Bionics. So we had a nice range of the most important international exoskeletons that are on the market. The program of the exhibition and talk was that we had a short welcome, then the companies introduced themselves, then every exoskeleton developer could have a 2-minute pitch so that everyone knew what kind of exoskeleton developers are there. And then we had a 2 hours open floor exhibition where people could just walk around, get in conversation with the exoskeleton developers, try on exoskeletons, ask questions, things like that. So to really get people connected with the exoskeleton developers. And after that, we split the groups into arm and back exoskeleton groups. And then we had discussions on use cases. And also, so for example, we asked each company for a specific use case they could think of where they might see a potential for implementing an exoskeleton. And we discussed about that. And we also asked them about positive and negative experience with exoskeletons. And then we had a closing. I will come back to the results a little bit later because I want to combine that with results from another study that we did. So another study that we're currently busy with, which is also really important to do in my opinion, and that is not happening enough yet, but I hope it's going to come in the future, is real field studies over a longer period of time. Because we now know that exoskeletons can be effective preventing people from or supporting them doing their work, unloading their back or unloading their shoulders. But we do not know whether people will also accept the exoskeleton over a longer period of time. What if somebody takes an exoskeleton into a working environment for like half a year, Are they still using it after half a year, or do they just throw it away and say, no, sorry, that's nothing for me? And we wanted to we started one of these field studies with plasterers. And our objectives in the study was that we wanted to address the preconditions for successful implementation, and we wanted to address the effects on workload. And therefore, we gave 45 plasterers a shoulder exoskeleton, the Skelex, and they were able to use this exoskeleton for 6 weeks during their work. The study setup was that we first had a kickoff. We explained the whole study setup and the questionnaires that they had to fill in. Then we had a fitting session, so everyone got their own exoskeleton that they would work with, and we adjusted them to their body. Then they were working 1 week without the exoskeleton, kind of as a base measurement, and then they worked 6 weeks with the exoskeleton. And we, after week 3 and after week 5, we called in and asked, yeah, how do you feel about working with the exoskeleton, and what is good, what is not good, things like that. And we sent a daily questionnaire asking them about, for example, this is in Dutch now, but it says, what did you do this day in your work, and how long did you do that? And then they would fill that in, and a follow-up question would be, did you use the exoskeleton during that task or not? So to see, is there maybe a shift in task that they use the exoskeleton or that they don't? Another potential question could be, or was, that we asked them to say how much discomfort they have in certain body areas. As I said, the study is still running, so I can't really show you results yet. I can only show you preliminary results of the talks we had with them doing the interviews on the phone. So what you could see was that in the first weeks they were still trying out a lot of tasks, giving every task a chance, and just to see whether the exoskeleton could be of a potential support or not. And then in the last weeks, you saw that there was a shift towards a selection of tasks, so that they said, yeah, doing ceiling work, it's really nice, but doing wall work, it's less nice. And that's also a bit what we expected, and it was nice to hear that already. Then you hear a lot that you really have to get used to it. And for some people, it's really challenging. There was one person who said, I feel like I'm locked up in this thing, because he's been working as a plasterer for 25 years already, and now all of a sudden you have to work with a device. And then the exoskeleton takes in a lot of space, they say, even though the Skelex is already quite an exoskeleton that doesn't stick out that much. But still, if you work in small rooms, it's a problem. And sweating was a big problem. We had one group that was really working in the heat, and then it leads to skin irritation if you start sweating. And another point was that the exoskeleton gets really dirty. So this is an exoskeleton after 6 weeks, and we really had to clean them a lot. So I wonder how they look like if somebody uses that for 6 months. So main challenges based on this work that I do at TNO. Number one, an exoskeleton is not the number one solution. So when if you want to implement an exoskeleton, first think about other solutions that might be possible. And a lot of companies don't do that, and we always have to remind them of that. The second one, acceptance by the end user, is dependent on the use case itself and also on the individual employee. So you can't, like, for one employee it might work, for another one it might not work, which is also a challenge. Then there's often a high variety of tasks and postures at work. So normally exoskeletons are good for repetitive work, and you always do the same movement again and again. But there are not a lot of jobs where you see these repetitive movements. Even if you think for some jobs that's the case, it's still not. And then it's really complicated to think of how can I implement an exoskeleton then. And I think, in my opinion, an exoskeleton is probably going to be more of a tool for certain tasks that can be used for maybe an hour when you do something, and then you put it aside again instead of using it for your whole job. The fourth one, be aware of your goal. Because do you want to reach a better health of the employee? Do you want to reach better productivity? Based on your goal, your implementation strategy is also going to be different. And another challenge is that you always need good instructions and actually a long-term training so that people really know how they use this exoskeleton and use it in the right way. But this long-term training is also hard to implement during work. So that was it from my side. I hope you enjoyed it. Sorry that I couldn't be there in live, but you will see me during the discussion round. Thanks for your attention.